Hello there. Today we are going to discuss thyroid disorders. Now, thyroid disorders aren't uncommon. According to the American Thyroid Association, more than 12% of the U.S. population will develop thyroid condition during their lifetime. That's an estimated 20 million Americans. Of these Americans, women are 5 times more likely than men to develop a thyroid disorder. Most thyroid disorders are lifelong conditions that are manageable. The two main types that are seen in the U.S. are hyperthyroidism and hypothyroidism. We can also see goiters and thyroid nodules. Goiters are not so common here in the U.S. now that we have iodized table salt. They are mostly seen in third world countries where they lack iodine in the diet. But it's not saying that they aren't unseen here. What does the thyroid do exactly? Well, the thyroid is responsible for metabolism, growth, and development. It helps regulate the majority of the body's functions. It can't properly function without the pituitary gland, which produces TSH. That is the thyroid stimulating hormone that is released, and the thyroid detects it and is stimulated to produce thyroid hormones. Now we have 3 main thyroid hormones. We have T3, T4, and calcitonin. T3 and T4 work together to regulate basal metabolic rate. So that is your body temperature, your heart rate, food metabolism, brain maturation and growth in children, and activation of the nervous system. This is why when we go to look at symptoms of hyperthyroidism and hypothyroidism, you will see these things being all out of whack. We also have calcitonin, that is the third thyroid hormone, and that is involved in calcium metabolism and bone mineralization. So hyperthyroidism is the first one we're going to look at. That is your overactive thyroid. It is an overproduction of thyroid hormone, specifically T4. Possible causes of this disorder are Graves' disease. That is an autoimmune disorder. It is seen in most cases. We also have thyroiditis, which is inflammation of the thyroid gland, common after pregnancy and the birthing process. And there's also hyperfunctional thyroid nodules that could be present, causing the overproduction of hormone. Risk factors, family history, specifically of Graves' disease, being female, and also certain chronic illnesses can put you at risk of developing hyperthyroidism. On the opposite end of the spectrum, we have hypothyroidism. That is your underactive thyroid, where there is not enough thyroid hormones being produced. Possible causes of this, it could also be caused by autoimmune disease, specifically Hashimoto's disease in this case. It could be an over-response to hyperthyroid treatment, where we're trying to suppress those thyroid hormones, and then we do it a little too well, and then aren't enough. There could be thyroid surgery, radiation treatment, maybe for cancer, medications, specifically psych medicines like lithium could interfere with that thyroid hormone production. Pregnancy, babies can be born without a thyroid, so there could be a congenital disease that's contributing. Pituitary disorders, we have a lack of TSH production, therefore lack of thyroid hormone production, or an iodine deficiency. Risk factors for hypothyroidism are, again, family history, female sex, being older than 60. As you age, your body starts to degenerate, and that thyroid hormone just might stop being produced as well. Autoimmune diseases like type 1 diabetes and celiac disease have been associated with hypothyroidism. Having radiation treatment in the neck, chest area, or thyroid surgery where part of your thyroid's removed, maybe for that hyperthyroidism treatment. And again, other previous treatments for hyperthyroidism, like the radioactive iodine or the anti-thyroid medications, could cause that lack of thyroid hormone production. And pregnancy, specifically delivery and that birthing process within the past 6 months, could be a contributing factor. So taking a look at our symptoms here, hyperthyroidism, we're going to have unintentional weight loss because our metabolic rate is going to be higher. We're going to have that rapid heart rate, increased appetite because of that higher metabolic rate. There might be nervousness, anxiety, irritability, tremors, sweating because your body temperature is up, therefore your increased sensitivity to heat. You might have changes in your menstruation, more frequent bowels, fatigue, muscle weakness, difficulty sleeping, thinning of the skin, or brittle hair. Hypothyroidism, again, you might see some fatigue, but now we're going to have increased sensitivity to the cold because our body temperature is down. You might see constipation, dry skin, weight gain because your metabolism is slower, hoarseness in your voice, muscle weakness, aches, tenderness, stiffness, elevated blood cholesterol related to that slowed metabolic rate, joint pain, swelling, stiffness, heavier or irregular menstrual periods, thinning hair, slowed heart rate, depression, impaired memory, or an enlarged thyroid gland, also known as a goiter, which is what we're going to talk about next. Goiter, enlarged thyroid gland. Most commonly caused by iodine deficiencies in third world countries. It might also result from Graves' disease with hyperthyroidism or Hashimoto's disease, hypothyroidism, thyroid cancer, pregnancy, thyroid nodules, inflammation, multinodular goiter. And when there is a goiter, you will see it physically. It's a big lump right here at the base of your neck. It'll cause a tight feeling in your throat, possibly difficulty swallowing or breathing because it's pressing on your trachea and esophagus, coughing or hoarseness. Risk factors are that lack of iodine, being female, being over 40, having a family history of autoimmune disorders, and then certain medications or radiation exposure could cause it. Nodules are solid or fluid-filled lumps that form on the thyroid gland, and a lot of people actually have these. They just go undetected because they're so small and they're not causing any symptoms. They're asymptomatic. So these, again, could be caused by that iodine deficiency, or they could just be an overgrowth of normal thyroid tissue, inflammation, and that thyroiditis, a cyst, but they could possibly be cancerous or a multinodular goiter. Symptoms, when they become symptomatic, they might be felt or seen in the neck area. They could cause that difficulty breathing or swallowing. There might be unexplained weight loss or rapid irregular heartbeat, because sometimes when they are there, they contribute to that hyperthyroidism, that overproduction of thyroid hormones. So thyroid disorders are diagnosed mainly through blood tests. I have above the normal and optimal ranges of the hormones that they test for when they do a thyroid, a panel is what they call it. So if you're seeing higher levels of those hormones, that's your hyperthyroidism. Lower levels is your hypothyroidism. And nodules and goiters is a mix of how they're just off. They're not in those normal or optimal ranges. Physical examination can also be one of the ways we diagnose these things. Like I said, those goiters and those nodules can be seen when they get really bad. Then you have that weight loss and weight gain due to the basal metabolic rate changes with the hyperthyroidism and hypothyroidism. That changes in your skin, your hair, your eyes. Then you have those tremors or overactive reflexes sometimes. Further testing can be done for hyperthyroidism, including a radioiodine uptake test, a thyroid scan or a thyroid ultrasound pictured on the screen there. That is your lovely thyroid. Nodules. We can also do a thyroid scan. We can do a fine needle aspiration biopsy, which is very unpleasant from what I hear. They take this big long needle and they stick it right here in your throat. And they'll stick it into the nodule and they'll take out fluid. Mainly they do this as a monitoring process to make sure that the nodule isn't cancerous and doesn't develop into cancer, especially when they're like asymptomatic. Just keeping an eye on them before they become something more serious. Or we can do ultrasonography, further testing for goiters. There's something called an antibody test, ultrasonography, or again, that biopsy. All these conditions are treatable and manageable. With hyperthyroidism, we can treat it with radioactive iodine, anti-thyroid medications. I have 2 of them listed right there that are most common. beta blockers, or surgery, which is called a thyroidectomy. That's where they remove either the whole thyroid or just part of the gland. Hypothyroidism is mainly just treated with synthetic thyroid hormones, two main ones listed right above. The dosages of those depend on the severity of the disorder, because sometimes the thyroid may be producing some hormones but not enough, or it might just be not producing at all. Goiters, we can do thyroid hormone replacement, we can do surgery, we can do radioactive iodine, and nodules, thyroid hormone suppression therapy, because again, that's going to really, nodules tend to contribute to the overproduction of thyroid hormones, or we can do surgery. So exercise isn't going to cure a thyroid disorder. You do need to treat those with the treatments that I just previously mentioned, but it can help improve thyroid function. So persons with thyroid disorders are encouraged to exercise. However, hypothyroidism, you're going to be tired. You're going to have muscle soreness and weakness, therefore reduced exercise capacity. Hyperthyroidism, your metabolism is fast. You might overheat. Your heart rate's faster, so we don't want to have a heart attack. So we just got to be careful of that. And goiters and nodules, that large thing in your neck might make it hard to breathe. So exercise can increase plasma level of concentration of hormones, the thyroid hormones and TSH, when the thyroid hormone levels are properly managed with medication first. And different exercise intensity affects the thyroid hormone production. 70% max heart rate has been found the most effective in a study that was conducted in 2005. I have the little results of that study right up there. You see the exercise group and the non-exercise group. So here's my case study. We have Danielle. She's 25 years old and has been diagnosed with hyperthyroidism. Her total cholesterol is a little high. Her triglycerides are slightly elevated. Her blood pressure is normal. Her heart rate is normal. She has experienced some unconditional weight gain. Her BMI is 25.6, which is considered overweight. And she would like to return to a healthy BMI. She was a previous marathon runner, non-smoker, no family history of cardiovascular disease. However, her mom had a thyroid disorder, and she does exercise regularly. So we're going to give her a little test. We're going to do a Bruce treadmill test for her cardio. We're going to give her some 1RM testing, some muscular endurance testing, and some flexibility testing, because flexibility should be included in all workout programs. And here's just an example of an exercise prescription I would prescribe Danielle. We're going to do some aerobic, 3 to 7 days per week, resistance 2 to 4 days per week, non-consecutive, and flexibility 3 to 7 days per week. These are basically the guidelines for a healthy adult. Because once she does get that thyroid hormone under control, she exercised regularly, so she should be all right to work out like a healthy average person. Special considerations. At first, she might be tired and have low energy levels because she does have that hypothyroidism, and she is slightly overweight, so it's going to be a little difficult moving her body until she gets into that healthier weight range. Something to take into consider is that those people with goiters and nodules may have difficulty breathing and neck motion limitations. And persons with hyperthyroidism, as I mentioned, are at risk of overheating and possible heart failure because of their increased heart rate. So my conclusions, based off of the research I have done, thyroid disorders do require medical treatment, but once they are diagnosed and treated, they are manageable. Regular physical activity can potentially improve thyroid function and hormone levels, reducing the amount of medication of that synthetic thyroid hormone dosage that may need to be taken. So here's just a little look at my sources. I used a lot of them, but there was a lot of information to cover with thyroid disorders. So I hope you enjoyed my presentation here on thyroid disorders, and I hope you have learned a little bit about what they are, how to treat them, and how exercise can help improve thyroid hormone levels and thyroid function. Thank you.